Hi, I'm Gary Schwartz. I'm the Learning Technologist for Queen Mary, but based down at the School of Medicine and Dentistry. And my job is to make sure that all of our medical content is online. But we also have got Moodle, which is called QMplus, and we've used a few things to kind of help make it easier for the students to interact and also for the academics to do that as well. So we decided to use discussion boards, which are commonly used, but we decided to kind of rebrand it as like a student cafe, so that the students could feel free to discuss things without thinking that they were being moderated by the academics. They know that we stick our noses in to have a look every now and again, and they use it as a way to tell us when things maybe aren't working properly, or to have a bit of a discussion about some of the papers and material that they're doing there as well. And it's been very effective. If we look at some of the courses from previous years where we had very little discussion, we've now had, or particularly in our first week, we had more discussion on one course than we had in a whole year. So just by changing it and leaving the students to think it's a bit of a more friendly discussion board, it seemed to work. The other thing that we did notice with the discussion boards, some people had a few discussion boards about different topics. It didn't work so well. Kind of keeping it all in one seemed to work much better. And there's a more friendly attitude with the academics as well. They felt that they could talk to them on a first name basis. And it's built up good relationships, good networking with the students as well. So that's really good. And I've got to know some of them too. And they never seem to be rude on it. They're always very polite on a discussion board, as opposed to potential emails where people might be angry sometime. So that was one thing. The other thing we found useful was signposting everything, putting up good signs, using the labels, indenting so that people knew exactly where to go. Also putting into there as well, when people did go into, say, a book or a page, having a little link to return them back to where they were before, because that's not really obvious in Moodle. So that was a really handy thing to do, is to have that little bit of extra signposting. In addition to that, in the medical school we have to use a lot of clinical cases, and they're done really well on videos. So we've made a big effort to make good quality videos. We haven't exactly gone and got expensive crews in that, we've just made sure that we've done them right. Video is a little bit of an area for me that I've been doing for many years. But the students love them. We keep them short, we keep them to the point, and by making them nice and clear, good sound, and having a system that works really well. Our next step really, which I know the students will really want and is coming, is for it to work on all sorts of devices, Android, and also on the iPhone and iPad and things like that.